Tension headache, especially the chronic type of tension headache. How best to manage that? Is it want to concentrate on the management of the neck tension muscles there, or is it more cranial?
It's important, I think, to remember that true tension headache is usually not as disabling a condition as true migraine. So the patients with a featureless headache of mild or up to moderate severity typically will respond to simple analgesia, and if simple analgesia can be used at a modest level with modest frequency, that in itself is a good management strategy, and most patients who achieve that may not even present to doctors. When there is an underlying migraine biology, then that use of simple analgesia may in time become counterproductive, and that is one trap in the management of episodic apparent tension type headache with simple analgesia alone, and I think doctors should watch out for that. By convention, and quite typically, patients with that kind of problem will be offered amitriptyline. That's not in the NICE guidelines in the management of tension type headache, but is a very typical strategy in most clinics, and probably in primary care as much as secondary care. And that is an effective strategy. Often fairly low, modest doses of amitriptyline can be helpful in this syndrome. But again, it's important to remember that often this type of headache does not create too much of a burden. Other strategies, complementary strategies, can be helpful. So acupuncture is sometimes recommended in this situation, and some people find that can be helpful. For both for tension type headache and for low level migraine, there are other complementary treatments that I sometimes suggest, and those are the so-called nutraceutical type treatments, such as feverfew, coenzyme Q, butterbur, and magnesium. And these are available over the counter at health food shops, and some patients find those helpful.
Physiotherapy?
Physiotherapy, I think, does help, and I do have a physiotherapist work with me in my clinic, and they do have notable successes with certain patients. My own view is that where, for example, physiotherapy is focused upon the neck, patients, as you know, will often present with neck type problems. Patients with migraine very frequently will report neck-related symptoms as either part of the premonitory phase or the aura phase of their migraine, and during their active headache phase. The true cervicogenic headache is actually probably quite rare. When it's true cervicogenic headache, much more commonly there's an interaction between a pre-existing migrainous diathesis and a trigger caused by neck pain. And perhaps more commonly than that, what I mentioned earlier, which is a neck pain as part of the primary headache problem. True cervicogenic headache, I think, is probably relatively unusual, but patients do benefit from physiotherapy and other exercises to the neck when a painful neck is contributing as a trigger to an underlying migraine problem. So I do use physiotherapy now and again, and patients do report back that it helps, but I don't rely upon it as a primary strategy for managing headache.